Hi, I'm Eric Pulver. I'm an oral maxillofacial surgeon, and I'm happy to be here to share an expert tip with you. One of the things that is beneficial that we've implemented in our practice is storyboards, and we use a lot of clinical photography, and I sometimes then will laminate those images into a board that we can follow. So if we're talking to a patient about taking a tooth out, I'm often able to show them what happens if the alveolar bone walls are all intact and how the soft tissue will heal. I also can then show them what happens if there's a defect, a dehiscence in the bone, and how we then take a bone product, and I may show them on the images a few different types of bone products, how we place them into the area, and then we can augment the site or the extraction site and allow it to heal. And we also will show them the images of what a 3-unit bridge might look like, or a tooth. And we see those quite commonly in dentistry, and many of you may already be using that. But what I take, I think, to the next level is I try to script and hold meetings with my staff and write out paragraphs of what they should be saying, and use those images as a reminder for my staff to remember how to start that story conversation with our patients. Because by the time I come in, I've already had a short conversation with my staff member that's gone through that storyboard. So I know in room 1 or 2 or 3 or 4 what the conversation is going to be when it comes to what happens if a tooth comes out, what happens if I need a bone graft. And then my staff can share with me the concerns of the patient, and then when I come in I can reiterate that, and it helps to, I think, make our patients feel a little bit more confident and trusting that we're communicating and that we understand what their needs and what their concerns are. But it also helps them put into perspective the procedure and why we're doing it. So there's no question, you know, did I need it? If I say, guess what, you don't need that bone graft, they're pretty happy, and there's a trust that is built that way. And yet if I say, oh, the tooth came out and there's bone missing and we're doing the bone graft, they understand why we're doing it, and they're open to either doing it then or coming back another time to get it done. So I think that information is very helpful, specifically if it's broken down and simplified and shared consistently within the office. I also share those boards with my referral doctors, so the same message is going on between offices as well.